Hi, I'm Vicki Herrera, and today I will be discussing the difference in healthcare providers' scope of practice when comparing the advanced practicing registered nurse, the medical doctor, and the physician's assistant for course number NSC 842. As we compare the differences in the scope of practice between the medical doctor, the advanced practicing registered nurse, and the physician's assistant, we need to include the scope of practice that you desire for the quality of healthcare you want to provide. Analysis. Providing safe, quality healthcare to the public from either the advanced practicing nurse, a medical doctor, or the physician assistant requires a professional license that is obtained through the current state that you as a healthcare provider apply to. I will be applying to the state of Utah to be licensed as a psychiatric mental health nurse practitioner. Each state will have a department of professional licensing that ensures that the applicant has met the educational and supervised clinical hours required to apply for licensure. It is important to understand that the scope of practice that each of these health care providers are held accountable for. One issue that is going to arise that will impact advanced practicing registered nursing is the estimate that in 2030 there will be a shortage of practicing physicians in the United States. Advanced practice registered nurses and the physician assistant will be critical in providing health care to communities that will experience a deficit of medical doctors. A benefit to the provider and the community is that licensure for each profession's scope of practice is the legal authority granted to the provider that allows the provider to be reimbursed for healthcare services rendered. It also is intended to protect the public from unsafe and unqualified healthcare providers. Challenges for the healthcare provider is to make sure that the healthcare you are providing falls within your scope of practice when caring for your patients and your community. This directly reflects the ethical considerations to provide care. Ethical considerations are the same for the medical doctor, the advanced practicing registered nurse, and the physician assistant. Autonomy, beneficence, justice, and non-maleficence are the four main pillars of ethics. How the scope of practice affects the advanced nursing practice rules. These are some similarities between the scope of practice between the MD and the advanced nurse practitioner. Similarities of the advanced practicing registered nurse and the medical doctor include maintenance and the promotion of health, the prevention of disease, the ability to diagnose, provide treatment, and provide referrals and prescriptive rights. Prescribing Schedule II narcotics require additional licensing rights from the Drug Enforcement Agency. The physician's assistant's scope of practice is determined by what the medical doctor will allow and the physician assistant's personal scope of competencies. In other words, what the physician assistant is comfortable doing and the doctor approves. By staying within our scope of practice and working in a team-based setting, the community's needs should be met to cover the projected lack of medical doctors. When discussing your individual desired scope of practice, you may encounter obstacles that prevent you from practicing as you imagined. Your scope of practice may be dictated not only by your training, but the training of the company's staff, the availability of equipment, and the population you serve may not be what you anticipated, as well as the needs of your community. To overcome the challenges disrupting advanced healthcare delivery, each provider needs to understand and respect the differences in each provider's scope of practice. This allows space for each licensed provider to work together as healthcare professionals and to improve patient care. Conclusions. In conclusion, as we advance in our roles as advanced practice registered nurses, it is important to be aware that there are two different scopes of practices. One that is dictated by the state licensing board's requirements, which allow the advanced nurse practice nurse to work within their scope of practice once the parameters of education and training are completed. And the advanced practice nurse has obtained a state license and prescriptive rights. This allows you to be a valued member of a team-based healthcare system. The second scope of practice will be determined by demographics, patients' needs, and the economy. This could impact your personal job satisfaction. Questions for group discussion. What are your personal expectations regarding your scope of practice? And 2, how will the decrease in the practicing physicians' numbers in 2030 impact how you provide health care? Thank you for your time.